Hello and welcome to Local Health Now with Guthrie. I'm Renata Steele, and I'm joined here by Dr. Karen Kim, who's a gastroenterologist at Guthrie in Ithaca. And Dr. Kim, the last segment we talked about who should be having a colonoscopy and why. And this segment we want to talk about the actual procedure itself. So walk me through, please, what someone should expect who is going to be having a colonoscopy.
Sure. Well, for most patients, they will be taking this day off. Most patients will receive some sedatives just to make them sleepy and relaxed through the procedure, and we'll need somebody who can drive them home. And because of the sedatives, we don't recommend that they drive or work that day.
Okay. And now I imagine that a lot of people that you see coming in to have this procedure done are a little bit anxious or maybe fearful about the procedure itself. How do you help them manage that?
Sure. Well, a couple of things. For one, we reassure patients that that feeling is not, that they're not alone in having those feelings. It's, for understandably, an embarrassing procedure. They may be also afraid of what they don't know, so fear of the unknown. So that actually is helped with the sedation. So the sedation does have a relaxant quality to it, does help them relax. Our staff are extremely professional here, and we try to create and accommodate, an atmosphere and try to accommodate any requests that our patients have.
Okay, and now walk me through what happens during a colonoscopy procedure.
Sure. So during the colonoscopy itself, we use a small flexible tube. It's about the width of my index finger. It has a light source and a camera at the end of it. Once a patient is relaxed and sedated, and the room is darkened, we pass that tube all the way through their colon. What we're looking for are polyps, which are small precancerous lesions that we think can grow and transform into a cancer. And we can actually remove them right then and there during the time of the colonoscopy. This is one of the few colon cancer, or one of the few screening tests that we have that actually prevent cancer rather than just sort of remove or detect an early cancer.
Okay, and now what sort of prep work is there for the patients before they have that colonoscopy procedure?
Right, so for the vast majority of patients, the prep work is actually the hardest part of the whole procedure. The day before the colonoscopy, patients are asked after about noon to start only drinking clear liquids. Starting usually in the late afternoon, we start having them drink the liquid prep, which is the hardest part to getting that down. And that really does allow them to clean and completely purge their bowels.
Okay, but it's a very important part of this procedure.
It is very important, and what we often tell patients is your colonoscopy is only as good as your prep.
All right, well, Dr. Kim, thank you for walking us through this process and informing our viewers, hopefully making them feel a little bit more at ease if they have a procedure like this coming up. We want to thank you for joining us for Local Health Now with Guthrie.